Hello, I am Dr. Meher Rizvi, Associate Professor in the Department of Microbiology and Immunology, College of Medicine and Health Sciences, Sultan Qaboos University, Oman. I am also the lead principal investigator of a very interesting multicentric and multidisciplinary study, which we have nicknamed Dash to Protect Antibiotics. It focuses on urinary tract infections in low and medium income countries like India, Pakistan, Bangladesh, Maldives, Egypt, Benin, Ukraine, Iran, and a couple of high income countries, of course, Oman, where I am currently working, and Saudi Arabia and Qatar. The reason why we developed this study was because we felt that the quantum of antibiotics being dispensed in urinary tract infections, especially in community acquired or simple urinary tract infections, is extremely high and largely unregulated. So we decided to embark on an antimicrobial and diagnostic stewardship in UTI, and the focus for the last so many years has been simple UTI. We have amassed very valuable data on antimicrobial resistance emanating from these countries, on the basis of which we felt that we now need to expand our operations and understand the genomic basis of resistance, which was unfortunately very high even in community acquired urinary tract infections, and we felt that there is a great need to understand the underlying reasons for resistance in E. coli and Klebsiella. So, moving beyond human health, we are now partnering with Central Institute of Research in Goats, Farah Mathura, for understanding the prevalence of resistance in livestock. Prevalence of resistance in Escherichia coli and Klebsiella is our basic interest because that's what's also the most common in urinary tract infections, and they do pose one of the biggest problems in resistance worldwide. Beyond animals, we are also now embarking on understanding the prevalence of resistance, understanding the scope of resistance in the community through sewage. So we will be sampling sewage lines to understand the prevalence of resistance on a broader platform, which of course means not only phenotypic data, but we will be focusing on understanding the prevalence of CRE in pregnant women, which present to our obs and gynae departments of our partnering centers, in the primary health centers of the community medicine departments of our partnering centers, in all infections by E. coli and Klebsiella in livestock, and all E. coli's and Klebs isolated from the sewage. So the genomic surveillance will be carried out on the carbapenem resistant E. coli and Klebsiellas, and that will give us a very good idea about the types of resistance really circulating in our regions, the MLST clones, the virulence. Now, we're also very interested in the virulence because we'd like to understand what is the cost of fitness of acquisition of extreme drug resistance and pan drug resistance in our pathogens. The other part of our study is to understand the access of antibiotics in rural areas, in smaller cities, and we're going to be doing that in partnership with the community medicine departments of our partnering centers and also with an NGO which has a presence in 3 states of India, and that is Uttar Pradesh, Jharkhand, and West Bengal. They have a presence in 42 schools, and they are directly reaching out to around 50,000 students. These students are not just young students, they also have adult learners, and they have, by their vision, they have been promoting healthy living, and we felt that we should connect with them, and we also now partner with the citizens in responsible antimicrobial usage. And I believe this can have a very important and useful impact on antimicrobial prescribing, or at least antimicrobial utilization, because from my experience it's very difficult sometimes for doctors to change their prescribing habits. One can't blame them because of the excessive resistance in place, but with an empowered and engaged community, it becomes easier for the doctors to say no as well. And we have seen from our own experience that we have community people coming and saying, we said no to the doctor when he was prescribing antibiotics for my upper respiratory tract infection or for diarrheas. And so I believe that this multimodal approach is what is really needed to promote judicious and responsible antimicrobial usage. And this, I think, is going to be a game changer. But for it to become a game changer, we need to really engage them in a much more emotive fashion, and that's why we want to also collaborate with a very talented filmmaker. And Mr. Shumail Mirza has worked with us before as well, when we were working on the WOW campaign in 2022. And now he has his own personal reasons for really becoming one of the warriors, AMR warriors. He believes that narrative driven stories will work very well for bringing in low hanging fruit and bringing in people uh, as strong warriors or foot soldiers in our campaign against antimicrobial resistance and promoting good and responsible antimicrobial usage. And finally, communication is as important an act as any of the other acts we're invested in. And we believe that we would like to also invest in a good communication partner, so that whatever efforts we make, they are amplified and we reach more and more people, whether it is in terms of centers who join us or the community who understands the importance of their own engagement with uh, promoting and saving antibiotics for the future generations, and whether it is for promoting the documentaries, which can have a much larger impact on a much larger population and bring in much bigger dividends. So, together, we will be working for and getting very valuable data and promoting good practices, not only in the hospital but also in the community. And together we all become champions of antibiotics. Now, while we will be doing this for Trinity, our work with Dash to Protect Antibiotics will continue, and we will continue to promote and educate our clinical colleagues in judicious and responsible use of antibiotics when treating urinary tract infections. And in that, I'm very happy to tell you that First Line, a mobile app company in Canada, has offered to partner with us in this very important initiative and provide us the app free of cost, which will of course have the WHO awareness guidelines and will further lead to a sustainable impact of the education we are imparting to them. Thank you so much. It was a great learning experience. We've forged new relationships already, and we are looking forward to a very, very productive future with Dash to Protect Antibiotics, with the new partners it's created. And I congratulate all of them for being so proactive during this entire journey, which has been very enriching and very educative as well. So thank you, Trinity Challenge, for giving us this opportunity, for providing us very good roadmaps on how to go about applying for this very interesting and prestigious challenge. And applying for itself has been so empowering. Thank you. Thank you so much.